Welcome to our webcast. I'm Frank Long, Editorial Director of Rehab Management, and we're going to examine some of the strategies therapists can use for building a manual or power mobility solution that is ideal for their clients and patients. We'll also talk about technologies that are having the greatest positive impact on quality of life and how to get some of this equipment funded. Sharing her expertise for this discussion is Caitlin Boland, a Level 3 inpatient physical therapist for Gaylord Specialty Healthcare, a provider of complex medical care and rehabilitative services located in Wallingford, Connecticut. Caitlin authored an article about this subject in the 2021 March-April issue of Rehab Management. We're going to drill down further into some of the key talking points from that article and perhaps even get her to share real-life insights from a case study. Caitlin, welcome to the program.
Thanks. Happy to be here.
Let's get equipment specific and talk about manual wheelchairs. There are always trade-offs in the calculus for keeping manual wheelchairs light, comfortable, and functional. What should therapists keep in mind when trying to balance these variables?
First and foremost, I think it's very, very patient specific. So not only talking about the lightest weight chair, but learning a little bit about the patient. The interview is extremely important in prescribing a wheelchair. Dependent on a patient's home setting or activities that they enjoy, in which setting that they work, things like that. All of those things are going to make a huge impact as to what type of equipment is prescribed. On top of that, I think another really important factor is trialing different equipment. In this setting, we're very lucky because we have a lot of different equipment to try, and we have good relationships with vendors that we're able to get things here to try if necessary. We can educate patients all we want about what the lightest weight or the best option in our opinions might be, but until the patient actually gets in the chair and tries different things, I don't think that we're going to have a good understanding as to what would really benefit them the most.
Power assist. Some insurance payers focus on power assist devices for in-home use. However, some manual wheelchair users may primarily be interested in how a power assist can help them outside the home. Caitlin, how do you satisfy both parties without paying out of pocket?
So this has been a tough thing to always get covered, again, dependent on the payer. I would say that, like you said, most often payer sources are looking for how the equipment can help the patient get around the home. Sometimes we can spin it and talk about the patient either in their work environment, in their school environment, something that is necessary to their continuing life after they've been in the inpatient or even the outpatient setting. I think another big piece of it is, again, that education with the patient and saying, you really want this device to get around the home, to get around school or to get around work, but this device may also help you with this in your house or this in your house. And I think being able to educate them on how it would be beneficial in the home, and then being able to elaborate on that and document on that for the payer source is very, very beneficial in helping to get that equipment covered.
In your own experience, Caitlin, what level of satisfaction have power assist users expressed with the equipment they have?
I would say most of the patients that we have gotten this device covered for and that they're using it on a pretty regular basis. The biggest satisfiers really for these patients are the preservation of their joint integrity. So shoulders, wrists, less pain, really just the ability to keep up with family and caregivers in their community or even their home settings, and relying less on caregivers to assist with mobility in the home or in a community setting.
How prevalent is equipment abandonment for these devices?
Just from discussion with outpatient therapists and even discussion with some patients that do keep in touch, one of the biggest reasons for abandonment is just because of the time between ordering the equipment and trialing the equipment and then receiving that equipment. Or more often than not, it's 3+ months in between being evaluated for the equipment or trialing the equipment and then using it. And in that time, the client may just find other ways of doing things, or maybe, forgets how to use it. And when they receive that device, they do receive initial training, but sometimes they need more of a follow-up than I think they might get. And because they're not as comfortable with the device, they then don't use the device as much. So I think that follow-up and continued education regarding the use of the equipment is definitely important and would help a lot with equipment abandonment issues.
Let's talk about power wheelchairs. What makes choosing a power wheelchair drive control system challenging? And how do you work through those challenges to find the optimum system for your client?
There are many things that need to be considered when determining the most appropriate drive system for a patient. Looking at strength, endurance, patient preference. I think endurance being one of the biggest factors that we really look at. So I might have a patient trial a power wheelchair with just a standard joystick and they do great, but after 10 minutes or so, they're so fatigued that they're unable to continue to use it. So I think, again, trial and error is huge in determining the most appropriate piece of equipment or the most important drive control system for a patient. I can give you an example. We had a patient here a couple of years ago now who we had trialed all different types of drive control mechanisms with. We went from a joystick, a goalpost joystick, to a head array, to a sit puff system. And he fluctuated in his ability to do all of the above. So really we had the vendors coming in at one point, it seemed like multiple times a week to just try different things and work on the setup of the chair and determining what the most appropriate long-term solution was. And also, I mean, it was dependent on his pain, on his exact positioning in the chair. So there were so many factors that went into it. But I think the drive home point was that we had to get this patient in the chair as much as possible and continue to trial different drive control mechanisms to really see what worked best for him.
What are 3 recent power mobility technology developments that have had a substantial positive effect on quality of life among the population you treat?
Power standing function, power seat elevator, probably the anterior tilt function of a power wheelchair. And on top of all of that is the virtual seating coach, which is an app that basically allows the patient to get reminders as far as different means of positioning in their chair or repositioning and use of those power seat functions in order to maintain comfort, preserve skin integrity, and continue really just very good habits in the chair.
Can you share a case example for how these technologies have improved quality of life for someone you've treated at Gaylord?
We had a patient here, an inpatient who was here for quite a while, who one of her major goals was to stand up. And she was an outlier as far as our patients are concerned because she was actually able to receive her power wheelchair while she was still an inpatient here. So she was able to use it on a regular basis. And she actually, with her wheelchair with the power standing function, was able to drive herself around the hospital while in that using that standing function, full standing. And for her, to see the smile on her face, her quality of life was significantly improved. She was able to be at eye level with caregivers. She was able, in essence, to walk down the hall with her husband when he was here. And it was a really, really nice thing to see. Another example of this would be a patient that we recently had here who we were actually one of the major things that we were focusing on with our sessions were transfers. So being able to get from his bed to his chair without the use of a mechanical lift. And the hardest thing for him was scooting forward in the chair. And we actually provided him with a loaner wheelchair that had the ability to provide a little bit of anterior tilt. And with that, he was actually able to scoot himself forward independently and use a slide board to transfer from his bed to his chair. So I think that's just one example of an improvement in function and quality of life with the use of that power seat function.
We've been speaking with Caitlin Boland, a level 3 inpatient physical therapist for Gaylord Specialty Healthcare in Wallingford, Connecticut. Caitlin, thank you for joining us.
Thank you for having me.